This study was performed to explore if attachment style moderates how sexual trauma during childhood, adolescence, and adulthood influences interest in sadomasochism. The QR code can be scanned for the full research study. Historically, sadomasochistic preferences and tendencies have been considered manifestations of psychopathology by the psychological discipline. There is literature supporting a relationship between trauma history, SM tendencies, and adulthood sexual victimization, as well as speculation that a high number of BDSM practitioners have experienced past sexual trauma. However, it is not clear if these relationships are equally relevant through several of life's developmental stages. There is also little research on moderating factors that may prevent or increase the likelihood of these preferences. So the aim of this study is to discover if experiences of sexual abuse and trauma influence sexual preferences in a more sadomasochistic direction. To explore this, we investigated the possible effects of experiencing sexual mistreatment in childhood, adolescence, and adulthood on an individual's interest in sadomasochism, looking at attachment style as a moderating variable. Our first hypothesis was that individuals with experiences of sexual victimization in childhood and adolescence are more likely to rate higher on participation in SM than those who experience these things during adulthood or not at all. And then our second hypothesis was that secure attachment will moderate the relationship between trauma and SM preferences by reducing it to non-significance, whereas the relationship between trauma and SM will be stronger in those with insecure attachment. To do this, the data from 154 responders were used in the analysis for a cross-sectional study. For our first measure, we used two subscales, the sadomasochistic sexual fantasy subscale, which asks participants about their fantasies in several SM and non-SM sexual acts, and the sadomasochistic sexual activity subscale, which asks participants about their actual experiences in these same acts. We then had a measure inquiring how participants have experienced their attachment-related concerns in close relationships, where they were given an attachment-related anxiety score and a score on attachment-related avoidance based on their responses. And then finally, we had a measure which asked the participant if they had experienced a number of unwanted sexual acts during different age categories, which we altered for the purpose of this study to represent childhood, adolescence, and adulthood. And then for the analysis, we performed multiple correlation matrices examining the two-way relationships between all of these factors. We then performed moderation analyses to examine the effects of traumatic sexual experiences across age ranges on active participation in sadomasochism, using attachment style as a moderator. For the results, our first hypothesis was supported by significant findings correlating sexual victimization with SM interest and behavior, with the strongest correlations found with experiences of sexual trauma in adolescence and slightly lower strength correlations when experienced as adults, as predicted. Our hypothesis that the relationship between trauma and SM would be stronger in those with insecure attachment was not supported in the study. The final moderation, examining avoidant attachment's effect on the relationship between adult traumatic sexual experiences and SM action, displayed an interaction in the opposite direction than predicted. So in order to better understand the nature of the moderating effects, a slope analysis is presented, showing that higher avoidant attachment weakens the impact of adult sexual trauma on participation in SM. As we know, correlation does not equal causation, so we should be mindful about how we interpret these results to avoid making assumptions in clinical practice. The impact of pathologization can be harmful, so understanding the mechanisms of why these connections exist, rather than assuming, is important in the treatment of those who participate in SM activities, as well as those who have experienced any form of trauma. So our main finding that sexual trauma, especially when experienced in adolescence, appears to influence adult sexual preferences is not necessarily a harmful thing, as those who participate have reported that engagement in these activities may help traumatized individuals to work through their respective traumas through role-playing in a safe environment. Some believe that these sexual practices may be used as a healing experience. This project aims to bridge the gap between practitioner claims that SM and/or BDSM experiences can improve clients' ability to process their trauma, and researcher perspectives which deny or look past possible benefits of engagement in SM and BDSM activities. Further research is, of course, required to better understand these effects and the effects of other potential moderating factors. Thank you for listening. Please feel free to email me with any questions or comments on this study.